At Healthcare of Tomorrow, we gather the stakeholders that are shaping the future of healthcare, from C-level executives from hospitals and healthcare systems to policy experts, technology leaders, and providers. The conference allows both speakers and attendees to share insights, learn best practices, and collaborate to find tangible solutions to the issues they face. The Healthcare of Tomorrow Forum affords an unprecedented opportunity to gain high-quality exposure and meaningful access to the industry's top-level decision makers.
Hospitals will essentially be hospitals without walls, so to speak. Certainly we will still have very sick, acute patients that require that kind of intensive stay. But hospitals will have infiltrated their communities. They will be responsible for population health.
Well, most change or disruption has happened from outside of the industry. And I think healthcare is no exception. That it's very hard for a leader to reinvent their own industry, but you usually have to have somebody from the outside who sees that something's not working disrupt it. And I think we're seeing that now. We're seeing so much new technology challenging the way that we do things in healthcare, and we're going to expect to see major changes in the future.
Patients, and consumers are saying, you know what, my child is sick, I'm not going to go to the urgent care clinic. Give me the services where I'm at. And I think the mobile and other technologies have fundamentally changed how generations, particularly the millennials, are thinking about how they should interact with the healthcare system.
Now, with the current trends towards some of these disruptive technologies, we're starting to see leading health systems embrace innovation in a different way through healthcare information technology.
I believe the biggest opportunity for technology is impacting healthcare is leveraging the content and data within your systems to help improve quality of care. Standardizing the content, extracting the right content at the right point in time to enable better clinical decision support, to me, is the biggest opportunity.
We have absolutely embraced technology. I would consider us an early adopter of electronic health record as an example. So we started with CPOE back in the 80s. Also, when I think about technology, I think about 3D printers and our investments in digital health. So I would say between our research institute and the bedside that we're extremely focused on technology.
Trying to imagine what a hospital would look like 20 or 30 years from now is impossible. We struggle just even thinking 2 years, 3 years, 5 years down the road. We believe at Cincinnati Children's that one of the trends that we're very confident about is that they'll be much more focused on care outside of the hospital as opposed to inside the hospital.
So I think in the next 20-odd years, most medical centers will become specialty centers where only the really high-end, high acuity care is needed and provided, because much of care will move into the outpatient arena.
It sounds a little bit science fiction, but it's even possible that one might envision surgeries being done in the home with robotics or with the surgeon there, and then all of the post-op care being there where the patient's most comfortable and have all their supports.
I think what healthcare providers can learn from others outside the industry, especially people who are disrupting other industries, is leveraging big data analytics in the cloud. I see the health community and health software as a service moving to the cloud more rapidly than probably any other vertical.
In my mind, I think there's a lot that's been done over the last few years around building up EHRs and improving the flow of patient data. There's an opportunity now to improve the flow of people, both patients and providers, and really connect all that's happened in the transportation space with the emergence of on-demand ride-sharing platforms, bring that to healthcare, and ultimately get patients the care they deserve.
So I think hospitals are going to look really different. We are, I think, on the verge of really reconceptualizing what is hospital care. Of course, we're always going to need hospitals, but I think only the sickest and the most complex patients are going to be there. I think we're going to see more specialized institutions, but at the end of the day, we're still going to need general hospitals. We're going to need institutions that can take care of people who have a variety of illnesses. So I don't think there's one model of what hospital care in the future will look like. We'll see a lot of diversity and a lot more focus.
We'll be back next year in DC, where healthcare executives will convene to learn, collaborate, and address the critical issues that are impacting their success.